everyone. Welcome to the very first episode of our CEO podcast series, where we dive deep into the stories of game changers who are changing the scene in the healthcare industry. I'm thrilled to introduce our first guest of the series, Mr. Abhinav Shashank, the brains behind Innovacer, a health tech unicorn flipping the script on healthcare. Now picture this. From humble beginnings in Lucknow, with a degree in mechanical engineering from IIT Kharagpur, from being technically an outsider in the health tech industry to now shaking up the healthcare scene in Silicon Valley. That's Abhinav's story in a nutshell. Innovacer was born out of a game-changing idea a decade ago to unify patient data for better healthcare outcomes. Fast forward to today, Innovacer is the talk of the town, integrating complex data and driving actionable outcomes. In 2021, Innovacer became the first health tech unicorn coming out of India, and since then, the team is on a roll. Abhinav himself has earned several accolades, including Forbes 30 Under 30 Asia and Economic Times 40 Under 40. But behind the scene, he is more than just a CEO. He's a proud dad, a disruptor at heart, and the driving force behind the meteoric rise of Innovacer. So join us today as we sit down with Abhinav for a chat that is equal part enlightening and inspiring. Trust me, you don't want to miss this. Thank you. Thank you so much, Abhinav, for joining us, taking out time from your busy schedule and doing this for us. Welcome to DHN.
Thank you so much for having me.
Well, let's rewind a little bit and take a stroll down the memory lane. You grew up in Lucknow, and it must have been quite an experience. Can you share with us some of the fond memories or experiences from your hometown that you feel have shaped your journey into becoming a healthcare disruptor?
Yeah, I think Lucknow is the best place to be growing up as a kid. Like, it's just like such a incredible place in so many different ways. Like, we grew up, like, my dad is a civil services professional and just retired. And so, like, we've grown up, like, we grew up, like, I think, like, in different parts of Uttar Pradesh in India, but then eventually, like, I think, like, landed up in Lucknow for a really longish period of time. And as I was sort of like growing up, I feel like Lucknow is this place where, like, it's a city, but it's not like a mega city, right? Like, so you have everything like that you have, like, I think, like in a big city, but it's not like as hustle bustle in general. So it was a great environment to basically be growing up. Like, our family is generally very education focused, and therefore, like, early days were very focused for all of us in the family on, like, how much are you sort of like spending time on education and studying and all of those sort of like things. I used to, like, a large part of, like, I think, like, early childhood memories are very focused on, like, I think, school and friends, and like so much of the great experiences that you sort of like had forging like some of the most important like memories for you. So I think it was like fantastic growing up in Lucknow. Like, I till my +2, like, I studied in Lucknow, like in a school called Modern School, and it was fantastic. Like, I think one of the core things that they focused on was learning without cramming, and aspiration without fear. And I think, like, that sort of like struck a chord with me. Like, so I was really great, like, at I think, like, physics and math and stuff, which did not require cramming, and like was incredibly terrible at biology, which required, like, I think, like a ton of cramming. So, but like that, after that, like, I think, like, I graduated like +2, and then like went to Kharagpur for my undergrad.
Interesting. I was coming to the IIT Kharagpur question. You did mechanical engineering at IIT Kharagpur, and then you had a sort of shift to the realm of data analytics, and now you're in Silicon Valley, and your journey is nothing short of fascinating. Can you walk us through the moment when you realized your passion for data and how that led you to make the leap into this field?
Yeah. So I think, like, when you go to IITs for the first time, right? Like, there's this realization, like in school, like, you've always been like topper and like all of those sort of like things. and suddenly you come into IIT and like you find out like there are so many bright people around you, right? Like so all of your confidence for the first time sort of like gets a little bit shaken, like what is happening, and like how are all of these people like so incredibly bright, and so that was sort of like a little bit of my experience as well. It was very fascinating for me going into first year and like giving your exams for the first time, that there are these people like who had studied nothing and are scoring tens, and you have basically been slogging and you're getting like a 8 or something. And so I think like for the first time, the realization that sort of like happened for me was that there is just such incredibly bright talent like all around you, and this is going to be like a fantastically amazing like learning experience. And then like I think like as the second year started, and I got involved in like things like organizing the festival, like the Technology Fest and all of those sort of like things. And then after that, that was like a new revelation all of a sudden, like that you can organize and like tens of thousands of people are basically going to come like and pay money to really come to like something of that nature. At that point, I remember like in our third year when we were organizing, we had raised like 1 crore rupee for the rupees for the fest, right? Like, so it gave us like a lot of like confidence that if you wanted to raise money, like to do something meaningful, people are ready to sort of like invest in general. And in my fourth year, like then like we all, Kanav and I basically like Kanav is my co-founder. We actually started off like another business which was called like the Kharagpur Consulting Group. Now we were like fairly naive at that point. So like I think like our general thesis was that if Boston can have like a Boston Consulting Group, so we can also have like a Kharagpur Consulting Group that really comes out of India. So that was like the thesis. We started taking like technical consulting projects, which we did in collaboration with professors from IIT Kharagpur and all of those other things. That went off well. Like I think like we made some money, like I think like not significant, but still decent amount for a college startup. Like I think I probably remember it was like a few crore rupees that we had sort of like I think probably generated. Large part of it went to like IIT Kharagpur, and like some part of it also sort of like I think like came to us. So that was like a fun experience. It got me like I think like very interested and excited about like company building in general, right? Like now after that, like I think I had interned with this company called Ingersoll Rand, which was trying to build out for the first time their for India by India strategy. They were a Fortune 500 company. They had like thousands of people that were working in India, and they wanted to set up like I think a new business unit, and as an intern, like I got the opportunity to really work on that market analysis, right? Like what will it look like and all of those type of things. And it was amazing, like to just like I think like learn a lot of those things. This was like a hardware business, and so like we were toying with like what could like IoT and data infrastructures and automation in the home could basically look like. And like I was working with such wicked smart people like around me, like it was just like quite an experience. So I really loved that. And like I think like my thought process, even though that we were running a startup, was at that point that maybe like I need to get some of this commercial experience before we really start up. So I went to Ingersoll Rand as my first job, and I got to work between China, India, US, building out like that business, like for India by India. I was like pseudo chief of staff to like the person who was running this business. So I got to work on product. I got to work on engineering, supply chain, sourcing, business planning, marketing, a lot of those type of things. It was I was thrilled, like, and like I worked there for 2.5 years. Like we launched the business. It did like millions in revenue when I had decided to then like I think move on and finally start something of my own. So I went to Ingersoll Rand India CEO and said that I want to start something. He gave us $50,000 as seed money, right? Like, and Sandeep, who was like a coworker with me, like I think like at Ingersoll Rand, like he also joined in as a co-founder to the business at that point. So Kanav, who I had worked with at IIT, and then like Sandeep, I had worked with at Ingersoll, and I think all three of us sort of like came together. We started off this business called Innovacer. Now the only thing that we knew how to do was like actually data, right? Like because like I had worked on it, Kanav had worked on it, Ankit, who's our CTO, had worked on it, and so like we started building out what would be like a data platform for professors in some way. Like how do you get all of this unstructured data that's lying on the web, crawl it, parse it, structure it, and put it like on a database that everyone can have access to, and then like run like further analytics on. That was really fun. Like we built out like a fantastic product and we started selling it to universities. Before we knew it, like 65 of the top 100 research institutions started using it, and we were making like $1 million in revenue, right? Like, and so that was sort of like a little bit of the point where we realized that this is a real business, and then started the journey of like actually building out Innovacer.
Interesting, because you talked about how you started off as a product that was designed for universities, for researchers, but now you are a health tech unicorn. How did that shift happen? What was the moment of realization that no, we need to pivot into healthcare?
Yeah, so I think like we had started off building out a horizontal data platform, as I said. Universities obviously did not have like too much money to pay. Right, like so we were in 65 of the top 100 research institutions in some way or form, and we were still making just $1 million, right? Like, and so like we realized that if we had to grow this, like we have to really work with companies, right? Like, and the product was really, really good. I think like what we had built had very high quality, and so we took that to like large Fortune 500 companies. We got like, so in the second year of our business or third year of the business, we had Disney, Wolters Kluwer's, NASA, like all of these like Fortune 500 companies that we were starting to work with, and we had ramped up the business to $5 million or so like of ARR, right? Like, I think then we started realizing, at that point, we started realizing that we were doing too many things, right? Like because Disney's data problems and Wolters Kluwer's data problems and NASA's business problems are all very different like things. And while the same thing was happening, like we had one healthcare customer like in Des Moines, Iowa, called the Mercy Accountable Care Organization. That customer, we realized that like healthcare is so large and so complex, and I think like it could use like a layer of intelligence and a data platform like on top of it. And so the problem was very hard. It was very large. We thought like we could build like a fairly large business out of this for sure. So we shut down everything else. Like we went, like it took us 24 months to go from like 0 to 5, and it took us next 24 hours to come from 5 to 0. Right. Like, so we shut everything else down. We decided we are going to go focus on healthcare and solve this like layer of intelligence data platform product like in healthcare. And that was like, I think 2016, 2017 type of time frame. In the last 7-8 years, like we've basically gone from pretty much zero to hopefully like, I think like north of like a couple of $100 million in ARR at this point. Like, we feel like I think we're still like I think like the one of the fastest growing vertical software companies ever, right? Like so I think like the opportunity in front of us is pretty large, but our pivot to healthcare was because we felt that there is a need. There is a strong need here. Technology is fairly fragmented and broken. And if we are going to really solve, like I think, problems for patients and doctors, it needs a fundamentally new technology stack and not like things that are existing today. So that was like the thesis. It seems like we made the right choice, but like, these things like looking backwards always feel like fascinating, but when we were taking that decision, like it was not necessarily the easiest decision to take for sure.
Absolutely. Like you mentioned, it must have been a very hard decision, but in fact it has paid off, and it has paid off very well. My next question to you is, Abhinav, We talk about data for healthcare, but what exactly is it that you do? When you talk about unifying patient data for better healthcare outcomes, what exactly is it that you at Innovacer do?
So for the longest time, I think healthcare has been structured in a way where you go to a doctor and like they treat you and they look at it as a transaction. The insurer pays the doctor for that transaction. Right? Like that's basically the relationship that's been there. Now, over the last decade or so, people also sort of like realize that this is not the right way to do things, right? So costs have basically like risen because of this. Now, because you're incentivizing every health system and doctor that you need to do more, right? Like, so they are doing more. And now it basically suddenly costs $4 trillion for America to keep like, I think like people healthy, right? And the rate at which it's growing is much faster than inflation, right? So we're at the point where the government and employers really felt like that this is not sustainable. Like if healthcare costs basically keep going up like this, we're going to sort of like bankrupt ourselves, right? Like after payroll, healthcare is like the largest cost for all employers. And like overall, we spend like, I think $4 trillion, which is half of the world's healthcare spend is happening in America, right? So I think what people then have pivoted towards is that we need to pay doctors for keeping patients healthy, right? So which is the advent of value-based care and paying doctors like a fixed fee to keep you healthy and treat you whenever you are sort of like sick per se. Now, business model for healthcare is changing so dramatically in that sense, right? Like you are being paid for a transaction and now you are basically being paid for like a longitudinal care delivery like system. Because of that business model shift, you need like fundamentally new technology, right? Like you now need to understand who this patient is, like how many diseases do they have, like what was their history, like are they prone to diabetes, are they prone to like heart attack, like because if they are, like I want to just make sure that I intervene early and then basically put them on a better diet plan, make sure that they are coming to the doctor, getting their like heart rate checked, like all of those sort of like things need to sort of like happen, right? So for that, you need like a new technology. You need to like integrate data, all of the data around the patient that you can basically get your hands on. So all data that is coming from like electronic health records, all data that comes from claims system, all data that comes from labs and imaging and all of those sort of like things. So now you have like this 360-degree view of the patient. Like, you know, like who this patient is. You can now understand them better and therefore like have a lot more preventative care per se. So this is what we do at the first level. We create a 360-degree view of the patient so that like every doctor really has the view of the patient and they're not starting from scratch all the time. Right. Then on top of it, like how do they use it, right? Like you can accumulate all of this data, but like doctors are not going to open up dashboards all of the time, right? Like so we then build like I think like software to make it like easy. Like we have analytical layers that this is the analysis that we've done, and we think these are the high risk items for this patient. This patient is at the high risk of cancer. This patient is at the high risk of like diabetes. And like we put that out there like for the doctor that we've done our analysis. If you want to go look at the detailed chart as well, you can go do that. But there is a summarization that sort of like comes very early. Then we also basically like figure out what are the gaps in care. So if a diabetic patient is not coming to the doctor and getting their A1C levels checked, then that's a gap. Like you need to make sure that you're filling that gap and that the patient is sort of like coming to you proactively, because if you manage diabetes well, this person is far less at a risk of like a further complication, right? So we do like, I think like a lot of those software teams on top of it. And then also basically build like, I think like AI and predictive models to reach patients, make sure like, I think they are educated well and things of that nature as well.
Well, As you rightly mentioned, healthcare is fundamentally very complex. And I read in one of your interviews, you said that you're practically an outsider, and learning all of this must have been like a huge task. How did you manage it?
I think it would work to our advantage that we were outsiders a little bit, right? Because we knew that we had to learn a lot. Right. And we did not have any preconceived notions, right? Like that this is how like things are and things of that nature. So I think like what worked in our favor to a certain extent was that we were learning like with our customers like day in and day out. I remember when we signed up like the first healthcare customer, Mercy in Des Moines, Iowa, like we used to like live there, sleep there, right? Like at the like in the hospital, like we had like this room dedicated to us, and we were just there like all the time, like 24 hours. We would go like I think like for like a break to take a bath or something but like most of our time basically we were there and like living and breathing and learning, and a lot of our team was there. I still remember one of these days, like because we were like I think like coding at 4 a.m. and like in Des Moines, there was just the only room in which there was a light on was ours, right? Like this was an administrative building, and so the police van that was sort of like patrolling saw that there is like a light on in this room, and they came and checked what is happening, like is there some intrusion or something that has happened. But it just goes to say, like I think for us, we've been very, very close to customers at all points. And I think like a core part of our culture is learn with customers and build with customers. And we've been lucky, right? Like that, like customers have basically treated us as partners more than they've treated us as vendors. And so like if there is a partnership with like I think the customer, I think it's just so much easier to build out the right products that they need rather than basically just building out of gut feel. There was one Steve Jobs who basically could build for like, I think everyone. For all of us like who are like lesser mortals, we really need to basically hear what customers are saying and build that.
Absolutely. Abhinav, at the height of the pandemic in 2021, you became a unicorn, a first health tech unicorn in India. Then you also came up with the product Healthcare Cloud. Tell us about that, what Healthcare Cloud is and what it does.
Yeah, I think I think like our valuation is going to go like much more higher than where like I think like things are. But like my general sort of like view is around these things is you should be doing meaningful work, right? And we really enjoy what we are sort of like doing. I think like if you look at most people like in our business, I think people are really having fun doing what they're doing. These are engineers, they're working on problems that have like, I think like an impact, salespeople are basically, I think like working and closely like understanding customer problems, like translating it into solutions, helping them with a lot of these, I think like hard problems that they are facing. So I think like we're having a ton of fun doing what we're doing, right? And we're not we don't like treat valuations as too important as much as we think like there's a lot of upside in the business, and at some point we'll be a decacorn, at some point we'll probably be $100 billion business, maybe I think, but it doesn't matter. I think as long as the team is solving I think very meaningful problems and is enjoying that, that sort of I think ends up mattering a lot more, is our view. Now, when we launched the Health Cloud, our general thinking was that the first layer that we had built was the data infrastructure layer, right? Then on top of it, we had built analytical algorithms and all of those sort of things. Now we were also starting to basically build out software applications, right? The point of care applications, patient engagement applications. So we were not a data warehouse company. We were not a ETL company. We were not an analytics company. We had so much going on, right? That there is a data infrastructure warehousing play, there is an analytics play, there is software applications that are out there. So I think our general thesis was that this is all cloud software or cloud analytics, cloud warehousing for healthcare, right? So the easiest way we could have said this is like, this is the health cloud, right? Right, which is a ton of applications for all stakeholders over a longer period of time. We think we are going to have hundreds of applications. We have around 18 products today, but I think that number is probably going to be hundreds over a period of time. We're launching 6 products this year. We've acquired 3. We think we'll be acquiring a lot more in the future as well. So I think our general thought process is that this is going to be the platform on which a lot of hard healthcare problems will basically get solved.
One of the interesting fact that I found was data-driven population health management. That is a product that you provide, especially after the COVID-19 pandemic, and governments around the world have also been preparing themselves, devising strategy for early detection and care management in future if such eventualities arise. You work with governments at Innovacer. How does data help in population health management?
Yeah, I think everyone is going to move towards population health at some point, right? Because the way you need, if you are a health system or if you're a government or if you are an insurer, right? The way you need to start is basically by looking at who are the patients that I cater to, right? And then understanding who is the highest risk patient for heart attack? Who is the highest risk patient for any chronic condition, right? For that matter. And then basically go and work with them and prevent such things to sort of happen, right? That is the entire concept of population health, that you look at a large set of patients, stratify them into basically various needs, and then run programs on it. It's not to just treat you when you're sick, but I think really be proactive in care delivery. So we work with large health systems providing this. We work with 6 of the top 10 health systems in the US, working with their population health and value-based care teams. We work with multiple governments. We work with counties. We are starting to work with states like California here, and we are working with large insurance companies as well, like Kaiser and Humana and others as customers as well. So our general view is that this is relevant for anyone who is in the business of healthcare, right? This is not just the government, just the provider, just the insurer. It's relevant for everyone that is in the business of healthcare.
Interesting. Abhinav, let's come to the organization. Well, Innovacer has a remarkable growth trajectory, especially after it took the shift into healthcare. So maintaining that startup spirit must be quite the balancing act. How do you foster a culture of innovation and agility within the company while also scaling up the operations?
So it's hard, right? I think culture is I think the only sustainable mode for any business. I feel right? If you have to work on sustainability, as a CEO, you need to only be working on one thing, culture, right? Everything else basically sorts itself out, because the products evolve. Just look at Microsoft, right? They were Microsoft Office and Windows is what everyone knew them for, right? And now basically you think of Microsoft, it's a cloud company, right? And the transition that Satya basically did was that he repositioned the entire business towards being a cloud business, and they're going through another iteration of it where now you would start to know of Microsoft as an AI company.
AI company,
right?
Absolutely.
But what's consistent? It's that they're innovating very, very quickly, right? And they have this amazing culture of innovation, and people believe, including investors and their employees and their customers, that if there is something that comes at the cutting edge of technology, Microsoft is basically going to be there to support them, right? And which is the culture that we are sort of working very hard to build. And it's not easy, right? Microsoft has been in existence for what, 40 plus years. It's our 10th year, right? So I think, but we take that very seriously, right? And we just make sure that everyone that we are hiring, we just focus very deeply that we are a product and engineering company, right? First, and we are in healthcare, but like you have to understand that that is our DNA. Like we are a product and engineering business, and that takes center stage for us. And so like that's been a little bit of our culture, right? Like we're very product led business. Like we launch so many products. There is so much experimentation on products that is going on like all the time. Like if it was up to me, like we would be building 50 products in a year, but then like I think like that would require too much money. And so like we have to control like how much do we build like at one point. But I just feel like we are probably like, and I say this with no
Absolutely.
all humility, right? Like we are probably the most innovative company in healthcare, like by a distance, right? Like in software, right? Like we're building like I think like a lot more products than anyone can even think of right now, right? Like of products that we've already launched, but like we're launching 6 new products this year. We have a roadmap of launching like 11 products over the next 18 months. We also have like I think a roadmap of opening up the platform for other software developers to come and develop on top of our platform. We are acquiring like very rapidly. So we love building. Like we love building like across the business. And so like that's the one thing that I keep telling, I think like our customers as well, that one thing you should like definitely expect from us is that we will be like out there, like on the innovation and technological forefront. And you don't have to really worry about what's changing in the technological landscape, and we'll just be there, right? And then like I think technologies will evolve, we will evolve as company, like our products will evolve, but like maintaining that culture of innovation is not easy, but is also the most important thing that we are sort of like focused on.
Yeah. Absolutely. You have built such a fantastic company. It is only fair for you to take pride in it. So you mentioned about the evolving landscape and technology. I want to touch base upon the evolving landscape in the healthcare sector. In one of your interviews, you mentioned that you believe healthcare will transform itself and we just have to provide a platform. Now, the Indian healthcare sector is taking off in terms of technology, but it is still a relatively nascent landscape here. From your vantage point, where do you see it heading in the next few years? And are there any emerging trends or opportunities that excite you?
Yeah, I think like India is going to go through such a massive transformation. Like it's just India has always taken leaps, right? Like we never went through we were calling up people like on this like phone, pick up the phone type of thing, and suddenly like everyone had mobile phone, right? Like and then like suddenly everyone had internet, right? Like there was no credit card adoption like in India, and suddenly everyone is on UPI, right? So a lot of these things, I think India has taken massive leaps. It skipped a generation of technology in general, and really got an adoption of like a more modern technology stack. It's happened in finance, it's happened in like telecom, it's happened in like every other sort of like field. I think it's coming in healthcare, right? Like I think like we're not going to see like adoption of like electronic health records in India, right? Like we like that is not going to happen. Like I think like the way the government is basically building, I think the national health infrastructure, like or national data infrastructure on health, exchanging like information is going to become like far more easier. And now with AI, right, like all of these records are probably going to be like doctor and patient talking already, that already being documented, like a claim being generated on top of it. And there will not be like as much of a need of an EHR in India. Like I feel like, so we are probably going to see like some level of like skipping of technology here as well, like in healthcare. And that is just going to open up like things in so many different ways, right? Like the entire insurance space in India is very nascent still, right? Like you have Star Health and a couple of like other upstarts in the health insurance sort of like space. But the adoption of like it is so small, right? Like, so therefore, like there is this big health insurance space that is going to get opened up. Like if you look at the US, right? United Healthcare is the largest like insurer in the US, their market cap is like $500 billion, right? India doesn't have like a United Healthcare. Kaiser just released like, I think like their revenue reports publicly, and like they were talking about like 100 billion plus like health system in the US, right? And that's just like them being in a few states, like they're not even like, I think, national as yet. So I think like emergence of some of these things, like a more digitally enabled like Kaiser, a more digitally enabled United Healthcare is going to happen. Like, and these are massive companies, like $500 billion in market cap, and growing. Right? So some of these things, I think like we are going to see like over the next decade happen in India. Like we are going to see like the next India's United Healthcare, India's Kaiser, like maybe India's Epic, like all of those things sort of really come into fore and like really get built. So if you are like a founder, I think like far more people are focusing on fintech. But I think like the larger opportunity basically lies in health tech, and it doesn't feel like it today, but it will just compound so quickly, like over the next decade, that people who are basically building for it today, like are just going to like reap massive benefits.
No, absolutely. I agree with what you said about fintech and health tech. And in fact, there is an emerging trend where eventually it will sort of like integrate, where we will have a health tech integrated with fintech. And that also will open up massive opportunities on that front. But like you rightly said about founders who want to build for health tech, what would be your advice to them?
So I think like the biggest advice would be stay patient, right? Like health tech is far slower in adoption than fintech, right? Like fintech has basically been there like for the last 20 years, right? PayPal was like when, right? Yeah. And so that if you really are wanting to build something in health tech, it will take time, right? But you can build massive companies over a period of time. So like anyone who's basically like starting, just like no, healthcare is not a get rich quick scheme. Right. It's not so only do it like if you have the passion and interest for it. Like it is an incredible space to build companies. It has so much impact. Like you create like real impact in people's lives. But like it's not a get rich quick scheme. Right. So I think like that would sort of like be my only thing, that if you are entering healthcare, just know that it's going to feel slow, and like your peers who are like fintech founders would basically be growing like much faster, but it's a much more competitive space. Like building like, I think like a fintech business versus building like a health tech business, you can become a very large company like in healthcare, just because like fewer people are sort of like, I think like doing it, and it's harder and like it's more complex. And if you build something, then it can really create like so much value in the long term.
Absolutely. Well, I think this particular piece of advice will definitely help founders in India who are building for health tech. Thank you. Thank you so much, Abhinav, for joining us on this conversation. It has definitely been a very enlightening and inspiring conversation for me as well, personally. Thank you so much for joining us on this conversation.
Okay. Thank you so much for having me.